Dear students, very good morning to everybody. Hope you all are fine. Today's our offline class is about drug addiction and dependence. The drugs are normally used as medicines to help the patients cope with illnesses. But when these drugs are taken for purpose other than their normal clinical use, it is called drug abuse or drug addiction. Addiction is a habitual, physiological, and psychological dependence on a substance or practice which is beyond voluntary control. A person who is habituated to a substance or drug is called an addict. Repeated use of drugs increases the tolerance level of the receptors present in our body. Consequently, the receptors respond only to higher doses of drugs or alcohol, leading to greater intake. So, addiction is a psychological attachment to certain effects such as euphoria and a temporary feeling of well being associated with drugs and alcohol. In the absence of any guidance, the person gets addicted and becomes dependent on drug use. World Health Organization WHO in the year 1964 has introduced the term drug dependence in place of drug addiction. Dependence is the tendency of drug addict's body to manifest a characteristic and unpleasant withdrawal syndrome symptoms if a regular dose of drugs alcohol is discontinued. This is characterized by anxiety, shakiness, nausea, and sweating, which may be relieved when drug use is resumed. In some cases, withdrawal symptoms can be severe, even life threatening, and the person may need medical supervision. Now, the effects of drug alcohol abuse. Some of the common effects of drug or alcohol abuse are: number first, behavioral and physiological changes. Behavioral and psychological changes. The most common warning signs of drug and alcohol abuse among youth include drop in academic performance, unexplained absence from school college, lack of interest, withdrawal, isolation, depression, fatigue, aggressive and deteriorating relationship with family and friends. Number second effect, social problems. If an abuser is unable to get money to buy drugs or alcohol, he she may turn to stealing. Adverse effects are just not restricted to the addicts only, but also cause mental and financial agony to their entire family and friends. Number third effect, AIDS and hepatitis. Those who take drugs intravenously are much more likely to acquire serious infections like AIDS and hepatitis B because the viruses which are responsible for these diseases are transferred from one person to another by sharing of infected needles and syringes. Number next effect, misuse of drugs by certain supports persons. Some drugs like narcotic analgesics, anabolic steroids, diuretics, and certain hormones are misused by certain supports person to enhance their performance because these drugs stimulate or increase muscle strength oblique bulk and promote aggressiveness, thereby increasing the athletic performance. The side effects of use of anabolic steroids in females include masculinization, that is, features like males, increased aggressiveness, mood swings, depression, abnormal menstrual cycle, excessive hair growth on the face and body, enlargement of the clitoris, and deepening of voice, etc. In males, it includes again increased aggressiveness, mood swings, depression, reduction of size of testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of prostate gland, etc. The use of drugs and alcohol during pregnancy adversely affects the fetus. Now, next side effect, the chronic use of drugs and alcohol damages the nervous system and liver, that is, liver cirrhosis. This was about drug dependence or drug addiction, it is side effects. Prevention and control, it will be inshallah in our next offline class.